Hello everyone, I'm really energized and excited to talk to you today. I'm going to share a little bit of our experience with implementing Awardco in the past year and share a little bit of background of our program. So for those of you who don't really even know where maybe Omaha, Nebraska is or Nebraska is in general, our hospital is the only standalone pediatric hospital in Nebraska. We service a lot of states near Nebraska as well, and we have a 225-bed hospital system that's a nonprofit operating since 1948. A little bit about our structure of our hospital and the makeup of our team is we have over 4,000 employees. We're not necessarily just a pediatric hospital. We have specialty clinics with over 260 specialists, as well as primary care clinics. One really exciting piece about that as well is that we're opening a new behavioral health and wellness facility in a couple of years to really focus on increasing mental health access for our patients in Nebraska. I talked a little bit about it, but we also have a lot of outreach clinics in other areas like South Dakota, Iowa, Nebraska. So we service other states outside of Nebraska, and we're on our 4th magnet designation. So a little bit about me and my role and then what I do at Children's. So I'm part of our well-being team. So we have the people pictured here. We focus on financial, social, emotional, physical, and community well-being. So part of our well-being structure is some programs I want to highlight. We have a paid volunteering program where our team members are able to volunteer within the community and get paid for that time volunteering. We have our Sunshine Recognition platform that's through Awardco that I'll talk about today. We have a furry friend, Howie, that you'll see in our picture, which we call our Chief Morale Officer. And he is a facility therapy dog that's just for our employees at Children's. So his sole job is to provide emotional support for our employees. He attends post-code debriefs. I get to be one of his handlers, so I have the great responsibility to get to round with him and spend time with him as well. And then we use a well-being portal called the Navigate Incentive Platform, and we recognize through that portal on Awardco or on our Sunshine Hub. A little bit about myself is I am a nurse. I have been a nurse for over 10 years. I started and only was in the pediatric critical care unit. So I was a nurse, bedside nurse, and then the nursing educator. So I basically trained all the other nurses. And then for the past year and a half, I've been on the well-being team as the employee experience program manager. I'm currently pursuing my doctorate in nursing at Johns Hopkins, and I have about 1 year left in that program. I have a young family, so when I'm not studying in school or working, I really enjoy sewing, doing craft projects with my children, and spending time in nature. So here's a little bit of the data that we've had at Children's since we've launched. We launched February 27th of 2023, and since we launched, we've had over 108,000 logins to our platform. So with 4,000 employees, that's about 22 per user, which I think is pretty incredible. And I love seeing that we're continuing that trend despite the launch and the year we've had the program. As far as numbers of recognition, we've had over 168,000 recognitions that have been spent by our team members, which is about 36 per person. And what I think is most meaningful is what you'll see down here, where we've had about 78% of our team members have sent at least one recognition. So that's what I really care about, is not how many are getting recognized, but how many people are actually taking the time to go and recognize one another, which I think is really beautiful. Our goal has been 75%, and so I'm really happy that we've been able to achieve that and to continue to grow it. We have a wide diversity of programs that you'll see here. We have recognition programs like our Everyday program, and that's where we get the name Sunshine Platform, and that's our name for the platform itself, where we have a peer-to-peer and leader-to-peer recognition program. We have a Brightest Star, which is our executive program where all of our executives and directors have access to give out spot-type bonuses. We have a lot of local area programs that recognize people throughout the organization, from our IT team who has points for program management, our quality and patient safety team who has that good catch programs that was referenced in the panel before, Our emergency department does special recognitions around patient experience. We also use our programs for internal award nominations for local awards as well as national awards. So this is what we use for our DAISY Awards to both nominate and select the winner. And then we have a couple other fun programs. So I know it was mentioned in the panel before, but that's what I really love so much about it, is that we can be creative and we can really tailor it to the unique client that is healthcare. And I'll kind of talk about that a little bit more as we go through the program. We do the traditional programming like milestone books, but one new feature that we've also done is this one-time memory book feature that's new at Awardco, where we're really trying to recognize about those life stages. So when someone is having a child, or they're graduating, or maybe they're moving to a new role at Children's, their leaders can also easily create recognition books for their teams to sign for those big life stages for them as well. You'll see a couple pictures throughout of our programs because I really wanted to help you get the feel of what it feels like, because I think a lot of recognition is about that feeling of warmth and recognition. So the top photo is our marketing team. They developed a 5-star club. So really talking about those Google reviews that we get for our providers. And so they go into those Google reviews and recognize providers that are receiving high Google reviews on the platform. What you see below is just our new employee orientation program. So our leaders really of our new employee orientation program take the time to get to know people in new employee orientation. They learn facts about their group, and they feel like each new employee orientation group has this own kind of culture within it. And so they take time to really recognize that group of people who went through new orientation. So our new hires are getting recognized by the company, but then individual people within that first week that they're also there. Just a little bit more of that detail of our programming. This is a picture of our DAISY Award. So even though this is a national award, we merged all recognition into the platform. So people go in and nominate them for it, and then we recognize the award for it as well. But what I love most about including these nomination type things in our platform is that we don't lose that goodness of when someone gets nominated but doesn't win the award, right? All of those nominations are shared back to the people who were nominated, which is really beautiful because someone took the time to nominate them. And so we are able to do that with a lot of conversation, and Awardco helped us to build those two separate platforms. This is a picture of that no harm, error safety prevention, which is a great initiative from our quality and patient safety team. And then this recognition on the right is one that, as a PICU nurse, I'm really grateful for, is that our bereavement committee, or our team members across the organization that focus on that struggle of losing a patient, came up with this idea where we send private recognitions after someone takes care of a patient that passes away. And it's not just the recognition itself, but we share our emotional support resources. So we share, this is how you get a hold of our employee assistance program. And so we really acknowledge that loss of a human life, even though it was a patient, it still makes an impact. And so we have team members in each of those departments that experience patient death that help to recognize those who cared for them in those last moments of their life. So you're maybe wondering, how did we get there? We have been alive for a year. We've had a good amount of recognition. So how did we get there? And I love that some of the conversation we had this morning already talks about the things that I even prepared for this presentation. And no, we didn't practice in advance and seem like we were trying to take everything together. But this is upon reflection, how did I get there? And I really think that it comes back to that listening that was brought up earlier this morning too, which the formal definition of listening is giving attention to sound, like you see on the slide here. And I love psychology. I love that kind of practice of understanding human emotion and human feeling. And when looking on research on listening, it was brought up before, that active listening, making good eye contact. But some of the new research that's come out has even shown that if you're telling a story to someone and they don't seem engaged, your story changes, what you share becomes even more negative, and I'm less likely to remember that experience. And so if I think about when I'm going around and listening to team members and rounding, like how can I change my perception of how I'm listening to them and not listening to respond, but listening to see that value they have to offer. And when I do that well, then they're more likely to have a positive experience with me, even if they're sharing something really sad or difficult. And so I think the biggest piece of how we got to where we are was with this listening. And that's what the rest of the presentation will cover, is really how we got there by listening to our team members at Children's. So we're gonna start, you each have a note card at your table, and this is a little interactive experience, and they did even share with me like free merch, which is pretty amazing. I can hand that out to people who are engaged, but what I want you to do is on that note card, I want you to write down your name, and I want you to write down what the best compliment you could receive is. So for me, right, I'm a healthcare worker, I am in school, but I would say my best compliment is that I'm a good mom, right? Because that comes back to like what I truly want is for my children to thrive in life. And so why is that the best compliment? Maybe it's like, despite pursuing these passions, like I'm still giving enough time to my family. So write down a little bit of that what and why, and then I know we're at tables of 5, but you could turn to the person next to you, make a group of 3, and just tell them what that best compliment is and why that is. And you don't need to listen to respond, just say thanks for sharing, and we'll bring this back full circle later. So I'll give you about 3 minutes to do this activity and think of your best compliment. Okay, thank you so much. It was really fulfilling to hear you guys engaging in that exercise, so thank you. We'll just leave that exercise there and we'll come back to it. So we're gonna just leave that there for a few minutes, and we're gonna move on with that listening piece. So I'm gonna break it up into 2 parts. How did we listen to our team member, or what we call our employees at Children's? And then how did we listen to the patient? And we're gonna really give specific examples of prior to implementation as well as now post-implementation, since we're a year into our platform. So prior to implementation, we had a number of focus groups. We have a shared professional governance nursing board, and so we went to that healthy work environment group and we presented our different platforms that we were seeking out, and we had them learn about each platform and pick what their favorite was. Same with our employee resource groups or our diversity groups at Children's. So we really gave our employees that choice on what was most meaningful to them, and that's where the choice with Awardco came from. It was a pretty clear choice, especially with the Amazon integration. And the other piece that we did is that we were really intentional about having the program launch after our employee engagement survey. And I think that's really helpful. Our employee engagement survey was before launch last year, and recognition was our bottom 5 at our organization. And it was something that, of course, the company said was a key driver to engagement as well. So they encouraged us to change it. So it was really encouraging that we were already on this process to changing recognition when that was really what our engagement survey was showing. And a lot of you might wonder where that name Sunshine comes from. You can see these sun cookies. So we'll talk about that a little bit later, but that was another thing, is our team members voted and picked the name of our platform because we really wanted it to feel like our organization. So we spent a lot of time rounding with launch and before launch with cookies like this and other things to really teach our team members about our platform. So I'm a nurse, and so I really love research, and I'm always going to tie it back to research. So I pulled in some of things from national healthcare organizations that really talk about recognition and that piece. So this is from the Institute of Healthcare Improvement Joy in the Workplace framework, where they talk about effective leaders really understand daily work, and they're able to provide that meaningful recognition and tie it back to the purpose. And what I really love about this is if we're not adequately listening, we don't really understand what the daily life of the employee is. And when we do meaningfully listen, we understand what that daily work is, then we're really able to give meaningful recognition, empower people back to their purpose, and really celebrate those achievements and why someone chose healthcare to begin with. So as a nurse leading this project, I knew these things. And I highlighted kind of the key point because I'll reference these later in yellow. But I know within healthcare, I don't have a lot of time, and if I'm a really good nurse, I'm in my ICU patient's room most of the time, right? And so it has to be quick, it has to be easy and accessible. Our positives need to outweigh the negatives. In healthcare world, if we tie it to research, we're more able to connect with the why and have someone buy into it. I knew our leadership involvement was crucial. It had to be fun, personalized, and creative to our organization. We needed to connect with employees when they had time, so I can't just send an email and tell them about it because most nurses don't really check their email. I never looked at our employee internal page. I really cared about my patients, so I wanted to be there and taking care of them. We had to give ownership to all employees, regardless of your level or what your position title was, and I knew that patient recognition and feedback really mattered. So how did we do this with Awardco? So one thing I really love is what makes it quick is that we have multiple integrations. So if our leaders are often in Outlook, right? So the fact that it was integrated with Outlook made recognition pretty easy because they didn't necessarily go to the home page or other places as much, but they were in their email. So the fact that they could recognize from their email or for teams where they did project management really helped. The positives outweighing the negatives. So this is where I'm going to really reference why did we choose the name Sunshine, right? And so I encourage you, if you don't have a recognition platform already, to think about a name that could evoke a sense of feeling and could evoke a sense of culture within your team. So though marketing would hate me for it, you see our little logo down there. That is not a sun, but we played off of the fact that it does look like a sun. And so that's where it was a tie to our organization, but what does recognition really do, right? When you get recognized and you feel valued, you feel warm inside, right? And what does the sun do? It warms us up, it gives us life, it helps us to foster and grow. And so we could really tie into that beauty of sunshine by this name. And that's how we created our positive marketing for it. So when we get recognized, it doesn't just say, you've been recognized, it says, here comes the sun, right? Because someone's spreading that warmth for you. When I rounded, I did play songs like Here Comes the Sun or Pocket Full of Sunshine. I really heavily laid in to that theme, so I was creating that. And then now I go around the hospital and people are like, did you send sunshine today? Or you are my sunshine. And because we have such a tangible feeling with recognition and it's really tied to it, I created that compelling vision for a change with recognition. Research, so like I said, I looked at multiple studies on recognition. We had joint leadership training sessions before we launched with all leaders, and Awardco was there, so we really tied into that why and how that ties back into our return on investment. Involvement from our leaders was crucial, as I mentioned before. And so before we launched, each senior executive sat down with me one-on-one and my manager, who is our VP of Benefits and Comp, and we trained them on how to use the platform. And I think it shows because our second highest department that recognized is our leadership senior executive team. So I think that relates to the fact that they all took an hour of their time to make sure they understood how to use the platform. We really tried into that creative piece. So Shanae was my implementation manager, who's amazing. And she helped me to create a lot of, well, she didn't help me, she did it. I just gave her the ideas and took the pictures. But we created a lot of gifts that were unique to Children's, which we'll see there. We connected a lot with our employees. So that listening theme, we rounded frequently. What do you want? What do you not like? What do you like? And so we did that throughout the whole launch and through the last year. The ownership piece is that I was adamant about the largest portion of our budget should be spent on our peer-to-peer recognition. So that's where we spend most of our money, and that's where we give our team members the power to recognize the goodness that's happening with them rather than solely a leader-to-peer program. We still have that, but our greatest budget is on me because though my leader recognition matters, when it's a really crappy day, it matters that this nurse helped me and so I could be safe for my patient. So I wanted to give all of our team members that power to recognize the goodness happening around them. And then I'll explore this more later, but our patient experience program was a huge component of what we did. So this is Shanae's work. She helped me create these, but These are GIFs, so they're videos. But these are in our platform that you can send with your recognition. So we really tied it back to recognizable themes with our organization. And once again, I'm trying to play off of my themes here. So we have umbrellas in one of our towers. So like, how could that relate to sunshine, right? You make me happy when skies are gray. So I see these a lot coming through the feed. And so I think just having something unique. And then our facility dog, how can we do that? Because he's probably our most popular employee at Children's for sure. And so we have a platform for him. So when I round with him, I try to find one team member that maybe really seemed like they needed to talk to him or be with him, and then he recognizes them. So we say like, woof woof, thanks for snuggling with me. And like on people's birthdays, we just usually will like write woof, you know, like stuff, and it's coming from him. So how can we tie it back to our culture and our team? This is a few other tangible examples of listening. So when we had our 1-year celebration, we had this sunshine cart here, and this is my favorite, but my daughter wanted to make the sign, so it says, "You are my sunshine," on the front. So just always tying it back to like, what are we here for? We're here to be safe for our pediatric patients. So how can we tie back to that? And so I'm all about learning, and we'll talk about some of the best practice frameworks from these organizations a little later. But we've been live now for a year, so how do we help people use this platform more efficiently, right? So we had this spinny wheel where they would get something that was related to sun, like sun chips, you know, sun-made raisins. Employees were not super happy when they spun and got raisins, but that's okay. And then we tied it back to a way to teach someone. So for sun chips, for example, our theme was like, chip away at recognition every day. Here's how you do it. And we had binders with pictures where we could show them how to do that. And then we always gave someone a prompt for recognition. So have you heard someone's having a wedding or graduating? We'll recognize them for it. So we gave those prompts. And then this is Sarah. With her permission, I said, can I share a little bit about you? And she's our chaplain at Children's, so she works with our HEMOC patients, but she has a T-cart. And so she goes around, and I knew she was someone who's a tangible example of someone who listens really well. So like, how could I empower people at our organization that were already doing it really well? And I'm sure you have examples out there that can be that image to your program. And so she, before we launched, had posters about our program on her T-cart. I gave her sun stickers to put on the cups themselves. And so she was just someone who listens, and I could always ask her for advice, expertise, and we have t-shirts now that say sunshine, and so she wears those around. And so who are those people that you can empower with your own organization who are already listeners and who are already going out there rounding, et cetera, that you can encourage them to spread the good work of your program? So we've talked a little bit about listening to employees, and now we're going to talk about listening to our patients. So how recognition ties to our patient experience. So my doctoral project at Johns Hopkins is looking at burnout, which studies say that 54% of nurses, physicians, and pharmacists are burnt out right now. And what is burnout? Maslow, who was the original research on burnout in 1981, discovered that there were 3 dimensions, and one was the cynicism or depersonalization, so you don't really see your patients as humans anymore. You have like emotional exhaustion, so you're really drained. And the last thing is like decreased professional efficacy, so you don't feel like you're doing a really good job anymore. And so a lot of research has really tied into how do we improve that sense of purpose, which then can tie back to that professional efficacy and feeling like you're doing something meaningful. So recognition itself is really something that has been shown in literature to tie back to that purpose. Another psychology principle that I used a lot within my training was this principle called the Lasada principle. And they studied the concept of human flourishing in general. And they found that there was a ratio of 2.9 from positives to negatives. So for me to flourish as a human, I had to have 2.9 times more positives than negatives. And I could think about every patient that yelled at me for being a bad nurse or whatever I do. But can I remember the more common ones where they just said, thanks for what you did today? Because those negatives outweigh our mind, and we're constantly embedded with negative information from media. I mean, I'm in a new role, right, where patients don't yell at me, but employees yell at me now, and I don't forget those comments. And so how do we outweigh those positives to negatives? And so that's what we're doing with our recognition platform, is we're trying to outweigh those negatives by embedding more positives. And this is how I got a lot of our doctors to buy in, because I'm like, oh, hey, let me tell you about the Lasada principle, because they're like, why do I spend time on this, Maddie? And like, isn't toxic positivity something that's bad? And so they really talked about how it's really, the ratio of too much positive is actually 11 to 1. So I don't think we're really going to get to that 11 to 1. And so we don't really have to worry about that difference. And then last, that recognition by patients matters. When they've studied it in nursing, they find that when you're recognized by patients, you have that value to yourself, like I'm doing something that meaningful, I'm doing something that matters. You see that value to your patient. I am making a difference in someone else's life because I am tasked with the biggest responsibility of caring for a stranger, and not only in pediatrics, but I'm caring for someone's most loved person. Wow, that's a lot of pressure. So if I'm recognized by the patient, then I can really see that value I'm bringing. And then if we're recognized, we're also valued by the organization, and they see us as meaningful to them. Healthy work environment from the Association of Critical Care Nurses has studied nursing recognition, and they said that the most meaningful recognition is one that comes from those patients and families, closely followed by peers and then leaders. And one thing I want to highlight is that we have, for the first time ever with Awardco, taken our patient experience comments, and I'll show you what that looks like in a little bit, and have de-identified them and have given them back to the providers who cared for those individuals. So our patient experience scores, we didn't meet our targets, but last year with the launch of this program, I can't say it directly, but we haven't met it for the past few years, and our goal was 80.3%, and we made our patient experience scores, meaning they rated it a 9 or a 10 of recommending it to someone else by 1.5%. So we met our goal this year, and not only met it, but exceeded it by almost 2%. So I had to obviously say, I know this matters, I'm a nurse, listen to me. But like that doesn't necessarily translate sometimes to the people I had to talk to make the decision. So Gallup has put out a lot of good studies on how recognition impacts our big key performance indicators at our organization. And as a well-being team member, this is what we're really working on, is our employee safety events, obviously retention, the operating margins, in a hard time of budgets and finances in healthcare. And so I really appreciate that we were able to meet our retention goals this year and all of those pieces, and I think a lot of it is tied to our use of our recognition platform. So another key player in the recognition space is the Association of Critical Care Nurses. They have a healthy work environment framework, and one of the pillars of their framework is recognition. And so I'll share some of their principles later, but they say that really we want to be valued, right? We want our organizations that we work for to show that what we have to say matters. And so that's really where, when we're recognizing, and I see this from some of our leaders, that we're able to recognize them for that value they're bringing to the organization, and that's really tied to that. So this is an example of one of our patient experience comments. This is our cardiac care unit, and I pulled this one because they already brought up about that psychology principle that we're more likely to exemplify those behaviors. So why do I think we met our patient experience scores? It's because we've shared over 40,000 comments back from our patients to providers, and we've never done that before. So it said, every nurse that came in contact with us said, did you guys need everything? They danced with our daughters. It was just like, this is a simple everyday thing that I did as a nurse every day, right? People would make fun of me because I would ask, do you need anything? So many times. And so, but like if we're recognizing them for those behaviors that matter for our patients, then we're really able to create that better experience. I brought up this principle early, and this is a lot of words in here, so we're not going to read through it word by word, but some things I really want to highlight is that healthy work environment framework really said that there's some things that really matter. For organizations, we need to make sure our recognition system is evaluated, so we're still including those questions, our employee engagement survey. It has to reach from the bedside to the boardroom, which is why we have that peer-to-peer, we have that brightest star where executives can recognize anyone in the organization, give that spot bonus. And then down here, for individuals, that everyone is responsible. So I think that's a really key piece to this, is that we gave that ownership and responsibility to everyone in our organization, and we tied it back to these healthcare organizations that are really leading the way in creating healthy work environments. So I'm going to end with 4 employees at Children's and a little bit about their recognition. And these are with their permission as well, but this is Amber. She is one of our senior level executives. She works in quality and patient safety. So she demystifies the myth that if you are an executive, you don't have time to recognize, because in the last year she's given 718 recognitions. And she said things like, and I pulled this comment because this was just last week, and it's so specific and it's just an everyday action, and that's why I pulled it. Because she said, seeing you deliver flowers to a teammate was super cool. And so she's recognizing so much that she's starting to notice behaviors, right? Would have you always noticed someone giving flowers to someone if you were an executive? I don't know, but because she's recognizing so much, she's just seeing these everyday actions. But my favorite story with her is, I'm in school, so I was with clinicals with CT surgery, and one of our new surgeons, who has no idea that I did this program, said in passing that I was recognized on the Sunshine Hub by Amber for making a mistake. And I was like, wow, if this is the culture here, that we're recognized for being honest about mistakes and wanting to get better, then this is an organization I want to be a part of. And so this platform made it possible for her to recognize him for that and really showed that surgeon what our culture is like at Children's. This is Linda, so I want to recognize her as someone who's gotten recognized frequently. So she's received over 65 recognitions and nominations. And what I really love about Linda is that she works in our cafe. And I pulled these 2 comments because these are nurses. One is ECMO, so she takes care of the sickest patients in the whole organization, right? Someone who's on heart and lung bypass. And she said, wow, when I have a bad day, Linda, like, you brighten my day. And the same sentiment was expressed by Morgan, who's a PICU nurse, who says, your job might not be obvious as other parts of our staff, but it's important and valued. So just like, think about how this has connected our employees across the organization by showing that no matter what your role is, it matters. And because you're always positive when I come down to get my meal on night shift, I am able to have a better day. And so I just will get tears in my eyes thinking about the fact that this ECMO nurse who takes care of the sickest patients is saying that this food service assistant is what makes my day better. And so, in taking that time to recognize it. This is Dr. Tucker. He's an excellent recognizer. He works in pediatric critical care medicine. And what I love about him is that he is not afraid to ask for help or learn more. I've sat down with him 3 times one-on-one just to teach him so he can use the program more. And though he does it, he's given 42, so nothing like Amber's hundreds that she's given. But what I love about him is that he is exemplifying that listening that we talked about and going back to recognize people. So he just had a random conversation with one of his advanced practice nurses, and he said, that nice conversation shares that constructive idea, so I know how to improve. So he showed that he listened, he recognized her for it, and really took the time to do that. So I feel like this demystifies that doctors are too busy, et cetera, to recognize, because he's a perfect example of someone who's still doing direct patient care as well as leading a team of physicians, and he's really invested the time to grow it in his team. And then I did not pick this on purpose, but there's Amber, that executive, commenting again. And so I just love how, she's going back in there and sharing that too as well. And then last, I'm going to choose Nicole. She's a nurse in our recovery room. She's a CARES nurse, so she's gotten one of the most number of recognitions in the organization. And it was funny because when I was looking through her feed, she had so many recognitions for starting IVs. And I was like, gosh, I wish I would have known this person existed so I could have called her to start IVs for me. But what's really funny is that this one's a little older recognition, it's from October, but I emailed and I said, hey, I'd really like to share this in my presentation. Are you guys both okay with it? And what she told me was, you know what, it's funny that you picked that one because that's the only one I've printed out and I have hanging up in my locker. So like that kind of stuff like gives me goosebumps as well. It's not some super long, like you're the best person I've ever had. It's just like that every day you cared for me and you helped my patient, but like how much did that impact her? So we never know these small moments we take to recognize how it could change someone's life, how it could help them when they feel in the hope of despair or feeling like what I do doesn't matter. I don't know if I have a purpose anymore. Why did I choose healthcare? Why did I choose these awful career? I mean, this is all these thoughts that have gone through my head. So I'm just speaking for myself. And so she really like helped tie that back to that purpose. And I think it's really, really beautiful. So coming back full circle, we'll have someone from Awardco collect your cards, and my goal with these is that you find, and we'll randomly distribute them, you find that person that wrote down their greatest compliment, and I want you by the end of this conference to go up to them and pay that comment. So we talked about listening, we talked about noticing, like can you notice how they do some of those things, like maybe if mine was being that mom or being a good mom, you could hear me talking about my children, so your compliment could be, you know, Maddie, like I heard you talk about your kids, I could tell you really care and you want the best for them, right? And so this is just a little exercise with this group of how we can take that recognition and we can start to notice behaviors and notice those behaviors and listen to them that we want to increase more in those people that we work with. So we have about 3 minutes left. Are there any specific questions that you have or that I can answer? Yes.
You mentioned, I actually manage the patient experience function
okay.
as well as employee engagement. So I'm curious how you integrated all of those comments
yeah.
from your patient experience platform into Awardco.
Yeah, so we have 3 dedicated people. It used to be me, but now I have 2 people on the patient experience team. So they are the people who sit at the front desk of the hospital or sit by, we have like a place where people can stay overnight if they have a really sick patient or sick child. So we just identified people that maybe had those roles, and they take the comments from our surveys and then de-identify them and post them to the specific person.
They are manually adding them?
Yep, but Awardco, from our experience, has also given a new website where we could just have a link and patients would put those in themselves. And we've used it for our providers that don't work at Children's, like we have doctors or physicians that work at other hospitals and come in. So we've used it for those groups of people. We haven't used it for patients yet simply because of our compliance officer. I don't want to like pinpoint one person, but it's hard to like get, you know, they want all these disclosures. So it's our own internal problem that I think I just need to keep pushing the envelope and pushing that boulder, and then we could decrease that system management. Yeah, any other questions that you guys have? Maybe I'll incentivize questions with these cards since I haven't used them yet.
I do have a question.
Yeah.
We don't currently leverage peer-to-peer recognition with points. And again, anybody in this room may be able to answer as well. Have we seen what kind of the best number of points per caregiver or per employee to award them has the biggest impact to make them feel they do have value, and it doesn't seem like, oh, I only got 5 points to give away.
Yeah.
You know, and it does more harm than good.
Yeah, so we started with 15 a quarter and we had them expire, so as a way for people to use them, which isn't really a lot, but that's like, with 4,000 employees is almost like hundreds of thousands of dollars, right? And we had surveys on the platform because we used Awardco to like even survey our employees, like what do you like about it? What do you wish could be different? And you know, I'm getting pushed from the executives or other people in HR where, oh, these comments mean a lot too. Like we should just not even have points tied with it. But a lot of the research says that when you have a little bit of incentives tied to it, that's the best way to really encourage that. So what we did is I gathered that data, like how do you do you like recognition without points, with points? And obviously more people said they like that recognition with points, but they still like the recognition itself. And so taking that data, our pulse survey showed a statistically significant increase in recognition at Children's, because we're just doing our employee engagement survey for this year right now. And so that was able to get 20 per person per year for us. And then we have other ways to earn it, like the well-being incentive, we give points out that way. And I would say, like, I haven't heard tons of negative feedback about I'm not getting enough, but what I really love about Awardco is that they're really always changing and doing new things. And so they have a new leader dashboard, and on that dashboard it shows who's the most recognized, who's the least, who's received the most points, who's received the least. So then since we have that leader to peer, they can really like recognize people or notice behaviors for people who aren't getting recognized to try to balance that out. So I wish I had a really good evidence on what the right amount is, but we had this budget to work in, and then we just did what we could do the most in that with that.
No,
so
that makes perfect sense, and I think that's a great amount to do. And then with the process, they expire. So if somebody didn't use them, we get them funneled back in, so we get cycled.
Yeah.
Back up.
So that's how we paid for our extra points this year. Is any that weren't given out by team members, we pre-funded for next year to have it go up. And so this year, what we're hoping to do is to even like do new programs with points that weren't given out, like if someone didn't use their points to recognize.
Can I just piggyback
Yeah.
a second? What percentage of the points, because obviously you have to budget for 15 per quarter per employee, what percentage of those points were actually used?
Yeah, so we had a lot of recognitions, right? It's like 30 per user. We probably only used about 30 to 40% of the points we actually gave out, and that increased as the year went along. Our leader budget was completely gone. Like all of the leaders had the points given away. And so that's why we're trying to, and how I'm a little risk adverse, right? Come from healthcare where I have a fear of making mistakes. And so I don't want to ever give too many points and then not be able to pay for it. So we all worked within our budget, and then now we're just trying to reallocate or develop new programs if they don't give their points out. And I've gotten lots of feedback. You get feedback all the time, and some employees are like, hey, can you take away the points from this person so I can have them to give them away? So we're always, and that's what we're hoping to do this year as we're in our second year, to try to reallocate if someone's not giving them out. All right. Yeah, so we have 20 now. So we went up this year after our first year. So it's 20, so it's like 80 per person per year. And then our leaders, they were at 250, and we increased it to 300. And theirs don't expire, so we have it annually. And then directors and above have access to that Brightest Star program. And then the other thing we've been looking at is, there's a lot of people that aren't people leaders, but do a lot of leadership type roles, and they've asked, hey, I'm an educator, I don't have direct reports, but I want more points because I impact all of these people who are orienting, right? I'm a patient access lead, and I manage the schedules. And so we're trying to, so that's one thing we're working on this year too, is how do we quantify these other leadership roles in the organization and do something with that? So something we're still figuring out, but do we create some sort of tiered leadership structure where people who do other leadership tasks but don't manage people could have more ability? So I think I'm getting way over my time, but anything else? Or are you telling me, see you later, Madeline? Okay, well, thank you. All right.